The following videos are designed to give practical information on how you can minimize the risk of infection in the workplace. These short videos will help you to increase your awareness of procedures recommended by the Centers for Disease Control, the Mayo Clinic, and the World Health Organization. Please take the information contained in the videos seriously and apply them to the best of your ability. Haskell values the health and safety of our team.
In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow. Avoiding close contact with those who are unwell. The appropriate use of masks and personal protective equipment, especially in a healthcare setting. Washing hands regularly with soap and water or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell. But if you have a fever, cough, and difficulty breathing, seek medical care early and share your previous travel history with your healthcare provider. That's a quick look at this emerging infectious disease. Given that this outbreak is evolving rapidly, what's known about this virus can change. Please check the websites below for the most up-to-date information.
Please self-screen at home to determine if you can safely go to the office. This should include a temperature and/or symptom check using CDC guidelines. It is important not to come to work if you have a frequent cough, fever, difficulty breathing, chills, muscle pain, headache, sore throat, recent loss of taste or smell, or if you live with someone who's been diagnosed with COVID-19. Seek medical attention if your symptoms become severe, including persistent pain or pressure in the chest, confusion, or bluish lips or face.
Today we're going to talk about using cloth masks and how to properly put them on and take them off. If you find yourself in a situation where you are using a cloth mask, it's important to do it properly so that you're using it in the safest way possible. So first let's talk about putting on the mask. The first step is always to use hand sanitizer or wash your hands. Make sure they're good and clean. And then you can take your mask. Now our masks here have this design with a loop that goes behind the head and an obvious side that faces out from your face as well as into your face. And the way that we put these on is put this on like this, put the loop behind the head, and then you can tighten these side straps and get a nice fit. And then, I'll turn sideways so you can see, you take it behind the neck and tie it tightly. And then at the end, so that's how that looks, and then you can adjust up here if you need to when it's loose. And then at the end you want to make sure that the nasal bridge wire and this part is fitting nice and close to your face. When you're done, of course, again, make sure you use the hand sanitizer or wash your hands. And that is how you properly place the mask. Now at the end, when you want to go and take the mask off, it's the end of the day or you're going to eat lunch, that's also important to follow certain directions. So you want to stay away from your face and away from the front of the mask and just remove the mask by lifting this off and untying from behind the neck, and there you have your mask. If I'm home at the end of the day, I just put it into a laundry bag or a pillowcase and throw it into the washing machine for a hot water wash with a hot air dry. If it's the middle of the day and I'm having lunch, I take care in terms of where I place the mask. So I tend to hang it somewhere away from people. Obviously we're social distancing, so that's not difficult. Or maybe set it on a piece of paper that I'll then throw away later, so that I can then go back and pick it up and easily replace it when need be. And that's how you properly take on and take off the mask.
Everyone has a role to play to reduce and slow the transmission of COVID-19. Social distancing is an essential step in preventing the spread of the virus. Practice social distancing by putting at least 6 feet between yourself and others. Also, continue to practice healthy habits to slow the spread of COVID-19. Learn more at cdc.gov/COVID-19 and coronavirus.gov.
You want to wash your hands. You think it's a fairly easy thing, and it is. If you follow these directions, turn the water on, get some hand soap, make sure that you spend time and make sure that you wash your thumbs. People always forget the thumbs. Make sure you wash your hands very well. And the word to the wise is if you can sing in your head happy birthday twice is about the right amount of time to make sure that we keep everything clean on the hands. Once you're done applying the soap, simply rinse. And then a quick elbow to turn it off. Now that you're ready to dry, these are the optimal type of dryers. What we want to avoid are the types of air dryers that actually aerosolize potential virus all around the room. Cell phones are something that we use all the time, and particularly if you hand it off to someone else and get it back, it's a good idea to keep the thing clean. So if you merely take a wet wipe, just spread it over the face of the phone and along the sides where we tend to hold it. It's really as simple as that. Anytime that you take a cell phone, your cell phone, and hand it off to someone else, get it back, it's usually a good idea to just do a quick wipe over the face of the phone. Many people in a clerical environment have a phone and a keyboard and a computer monitor. Some are touch screen, others aren't. But just take a basic wipe over the screen, over the keys on the keyboard, and over the screen itself, just at the beginning of the day. If it's something that it's a community, a shared desktop area, you probably want to do it each time that you're sitting down, at least through this part of the epidemic, or the pandemic rather. For a phone, if it's a community-based phone, wipe off each of the headset pieces, and simple as that.
Thank you for taking the time to view this important information. This guidance is up to date at this time. However, the guidance may change as our understanding of the pandemic changes. In addition, regulations may vary by state or locality. Please check the CDC website at www.cdc.gov or check with your local management to stay up to date.